Good morning and welcome to the Hindus Wellness Series webinar on monsoon illnesses, management and cure, jointly presented by the Kauvery hospitals. And I apologize for the slight delay in starting the program. The timing of the webinar is apt, as we have all seen how Chennai was and perhaps still is reeling under the pressure of cyclone, thunderstorms, and heavy showers during the past few days. Well, the monsoon gives us respite from heat and ushers in joy. During the rainy season, we also run the risk of catching common cold, influenza, sneezing, coughing, sore throat, and many other things. It also becomes a ripe breeding ground for mosquitoes and bacteria. There is a rise in several waterborne diseases such as dengue, malaria, chikungunya, types of fungal infection. The high humidity and the stagnant water during monsoons can also lead to the spread of cholera, diarrhea, dysentery, typhoid, jaundice, hepatitis, and several other infectious diseases, which we can also club as stomach flu. Whether we enjoy the rainy weather or we suffer due to excessive rains, the monsoon months are the time to be cautious about our health. So the pertinent question that arises is what can we do to guard ourselves from diseases and the various kind of ailments during this time? So to discuss today's topic, monsoon illnesses, and also perhaps break a few myths and kind of suggest valuable tips, we have a panel of medical experts from the Kauvery group of hospitals. And we will start the presentations with Dr. Vijayalakshmi Balakrishnan, Senior Consultant, Infectious Diseases at Kauvery Hospital, Chennai. Apart from MD and DNB in General Medicine, Dr. Vijayalakshmi holds an MRCP from UK and FRCP from Glasgow, besides a diploma in tropical medicine and hygiene. She will give her talk on types of seasonal flus, infectious diseases, their prevention and treatment. So, welcome, Dr. Vijayalakshmi.
Thank you, Soma. So we'll start with a small presentation where three of us are there. So we've kind of put it like why monsoon is becoming a major problem, what happens during this period. So I'm going to start with the problem statement. Slowly he will move towards how to handle it and what happens in the special population. So we in Chennai had a cyclone now, and it slowly moved towards this time. It went interior to right Pondicherry, quite a bit of belt around Chennai and North Tamil Nadu had the effects of recent cyclone. We did have a lot of bad weather, flooding, and a lot of trees falling down too. As we go up north, we did have a early onset of winter. So I hear that north is already cold this year. So combination of a cyclone and a relatively cold winter is what India is reeling around now. In Tamil Nadu as such, it's been much colder than it usually is. So what happens when these kind of weather situation happens? So you see infections and everybody worries about infections during this season. But apart from infections, we also just a minute. Oh, sorry. We also see an increase in the incidence of heart attacks and strokes during this period. So this happens because a lot of times any kind of infection predisposes to a slight change in the balance of your vascularity. Some of the infection can stimulate a vascular catastrophe. So we do see patients coming with more incidence of heart attacks and strokes, along with patients who have got a lung problem coming with a bad lung issue. So what happens? Why does this happen? Whenever there is rains, there is a fluctuation in temperature. When there is a temperature fluctuation, body behaves to that. Also, when there is rains and kind of flooding, fever rates also increase. So, why does this happen? We look at two angles, from a human being's angle and from viruses. Like we have to survive, viruses also try to survive. The bacteria tries to survive. Viruses thrive better in winter season, simply because the lower temperature leads to let them live for a longer period of time. So, for a virus to survive, it has to survive in an individual and transfer to another individual without getting killed in between. This transmission process is much better in winter. And when the virus attacks somebody, bacterial superinfection becomes much more easier and bacterial survival also becomes increased. Not just the routine viruses and bacteria. We have new viruses coming in this period. See, influenza is seen throughout the year, but we do see a rise in the numbers of influenza during the winter season and post-rainy season. So for us, the post-rainy season slowly emerge into the winter season. We also have some new infections which comes out during the post-rain phase. This can be because of vectors. Vectors are these are bugs which transmit infection from one person to another. The common things we all know is mosquitoes. Mosquitoes breed in the water, they bite people and bite somebody who has got an infection and then bites another person who's healthy. The healthy person gets it. This is how malaria, dengue, chikungunya transmits. Now, apart from this, we also have a few other infections which are transmitted by vectors. A classical example is something called a scrub typhus, which is spread by mites. So, post rainy season, when the rain goes off, areas, especially in South India, becomes lush green. And when you have shrubs everywhere, small mites emerge. The mite bite is painless. This can spread an infection called scrub typhus from one person to another. This infection can become mild or can be lethal also. Karthikeyan will talk about it in detail. Now, apart from these infections, we also have another problem with bugs when the indoor moisture goes up. So, take up South India. It has got this unique proposition of high humidity, and adding to the high humidity, you have moisture inside the home. This becomes a breeding ground for lot of fungi. And what happens with fungal infection? Whenever there is indoor fungus, your allergy asthmas become really bad. That is the reason immediately post floods, you see a lot of people coming with your asthma exacerbation, COPD exacerbation. Well, I am one. You could see my sound. I sound different. Whenever there's indoor moisture, my asthma becomes bad. And this applies to a lot of asthmatics in India. So these are with regards to bugs. So what happens to the human beings? So we are used to, our body is used to the kind of weather adaptation and temperature around us. Whenever there is a sudden change in the weather, body takes some time to adapt. The homeostasis alters a bit. Let's say you've got a really bright day today, the next day becomes cold. As soon as you wake up and go out, immediately your nose becomes stuffy. This is a node's adaptation to the cold. When you develop viral infections easily also, so your immunity get transiently suppressed, and this viral infection is often superadded by a bacterial infection at a later period of time. One more aspect is about human behavior. So we our people are either indoors or outdoors. When winter comes in, the indoor activity increases, and India being a crowded country, indoor crowding goes in. Whenever there is indoor crowding with a low temperature and high humidity, you see infections going up. So very simple about thought about cold and cold season. So everybody says people have cold and cold season, yes, but colds can be because of infections. Colds can be because of a response to the temperature. It can be because of allergies to the funguses or any allergens around you. So normally your nose tries to kind of avoid anything which can irritate it. So you sneeze. So when there is a sudden temperature fluctuation, there is some pollution in the air, or you get an infection, the nose becomes swollen and you start sneezing to push out the excess moisture or sometimes foreign body. That is what is taken as cold. A lot of times, if it's going to be something allergy induced or some kind of changes in temperature, it settles down. If you catch an infection around that time, it becomes more. And remember, catching an infection with a congested nose is much higher than otherwise normal.
Dr. Vijay, if I may interrupt you, incidentally, your
Yes, please.
slides are not moving. So I just
Oh
wanted to
no,
check on that.
sorry, nobody told me that. I'll just slides are
It's
not
okay.
moving.
You
I'll
can
just
just skip. You can skip those slides and move on to your.
no 1 minute. I'll
Yeah.
just share again.
No need to share all the slides again. You can skip the ones which you have already mentioned and go on to
Yeah,
the.
yes,
Yeah.
that's what I'm going to do.
Yeah.
Uh,
Right.
okay,
Yeah. Yeah.
right? Yes.
Yeah.
Now are you able to see this?
Yes. Yes.
Right. Okay. So with the temperature changes, we also had floods. When we are talking about floods, a lot of people had water entering into the houses. Sometimes it didn't enter into the house, but we did have trees falling down, vegetations decaying, some animals dying. So you had carcasses. So these are three things which most of us saw in Tamil Nadu. Along with it, there is a possibility of water contamination and food and water issues. We look into them in detail. Looking at the indoor moisture, if you've had floods inside your house or if there's been water stagnation around your house, there's a high chance of fungal infections coming up. They just are there around you. They don't fester and grow that much. In this particular season, you can have, if you have this kind of dark spots, please think about fungus. They have to be scrubbed off and you have to use some kind of hypochlorite to clean it up, your usual bleach. Otherwise, your cough will become more, sneezing will be more. If you have an allergic condition, you will have allergies. If you're an asthmatic, you can have asthma. If you have a lung problem, that gets exacerbated. Some people can have skin allergies too. Next comes receding water. A lot of infections come in with when you walk through the water or water lies stagnant for a long time. So we always think about malaria, dengue, and chikungunya. Yes, beyond that, if it's going to be a massive floods, we do see few other infections called leptospirosis, brucellosis, and melioidosis. Not going to go into detail. If somebody wants any question, please ask in comment box or chat box. I'll answer your questions. Skin infections, asthma, allergies going up. Flu also increases during this period, and unfortunately, there's an increased risk of heart attacks and strokes too. Why do we talk about unsafe food and water? We always used to talk about water contamination in summer. But then when you have floods, the chance of water contamination becomes higher. The water table gets contaminated with the good and dirty water gets contaminated. Whenever that happens, you use them for some purposes, you can have waterborne diseases. The common will be your diarrheas, fever, bad abdomen, vomiting, diarrhea. You can have cholera epidemics and typhoid fever. Typhoid fever is not something where you always need to have diarrhea. You can have high grade fever and then it can be a waterborne illness. Similarly, hepatitis A and E, these are fever with jaundice, again because of water contamination. Finally, when you have these decaying vegetation and carcasses, please make sure they are removed off. You should wear big gloves. You have proper gloves before touching them. Please decontaminate yourself. You have to put something like your hypochlorite, the bleach, on those areas where you find these decayed carcasses. Vegetations have also been taken out. Otherwise, you have certain bizarre infections. Fortunately, touchwood, Tamil Nadu has not had any of these infections despite repeated floodings. Finally, the common things, your malaria, dengue, chikungunya. See, if you have water stagnating around your house, you have a very high chance of getting it. Make sure the water gets taken off. And if you have shrubbery, make sure when you sit, you put some clothes or something, and when you come back, have a wash. If you see any kind of skin changes, meet a doctor immediately. So I'm going to stop at this so that my colleagues continue about the next part of it. As we finish off whatever doubts you have, please put it in the comment box. We'll take the question. Thank you.
Thank you, Dr. Vijayalakshmi, for that very informative presentation. And we will quickly now move on to our next speaker, Dr. S. Karthikeyan, consultant pediatric pulmonologist at Kauvery, Trichy. An MBBS from Thoothukudi Medical College. He completed DCH from Madurai Medical College and DNB from GKNM Hospital, Coimbatore. And he also did a fellowship in pediatric pulmonology from Institute of Child Health in Chennai. His talk is on cold cough fever in children and adults and causes, prevention, and management. So it's over to you, Dr. Karthikeyan.
Thank you, ma'am. So I'm going to talk about the common infections that are occurring in monsoon. Full screen, full screen. So first is influenza. This is a common viral upper respiratory infections. So all respiratory infections, upper respiratory infections, and usually presents its same symptoms. So almost all viruses will present symptoms like high grade fever, severe body ache, and the chills, and having high cough and running nose, and even throat. Sometimes some children or some adults may come with nausea, vomiting, and diarrhea. These are common for all infections. This is not at all exclusively for influenza alone. So how we are going to prevent? So most of the time, all infections can be prevented by simple hand washing. Hand washing prevents from all infections, not only from influenza, even water contaminated illness also you can prevent by simple hand washing. And for influenza, you can have influenza vaccination. For children, exclusive breastfeeding will have a lot of immunity that prevents from viral infections and complications. And wearing mask helps in reducing these infections. Apart from them, when you cough, please you have to cover your mouth and nose with a tissue when you cough or sneeze. So always don't touch your face when you go out. So this is just a simple slide showing usually these viral infections spread through droplets. So if both person wear mask, the droplet spread is very less compared to only one person wearing mask. So if both the person didn't wear any mask, the droplet spread will be more. So you'll get easily viral infections. It not only spreads through cough, even if you speak or even if you touch the cloths, it can easily spread. So it's not only a droplet infection, it can even spread through fomites also. And next is dengue. Dengue is, as already ma'am told, so it was the mosquito transmit this infection. So mostly these mosquitoes breed in artificial water collection. So these patients will have experienced, this is otherwise called as backbone fever. They have severe pain, bone pain, and have a high grade fever, headache, vomiting, and diarrhea. Some people may experience even altered sensorium, that is their sensorium will become altered and they even delirious, they will blabber some words when they have a high grade fever. So how we are going to prevent this? So cover containers, always avoid water stagnation. So mostly water will stagnate under the refrigerators. So avoid water stagnation in under the refrigerators. Clear, clog drain, and use mosquito repellents when you are going out, and wear long tight clothing, and use baby net for mosquito nets for baby cots, and close windows. And next is typhoid. Typhoid is transmitted through contaminated food and water. So the symptoms includes common high-grade fever. They have chills. They have severe abdominal symptoms like abdominal pain, nausea, vomiting, and even sometimes they have abdominal distension. Initially, these people will have diarrhea initially. Then later they have constipation at later course of illness. And rarely some people may have seizures also. That is fits. So we can prevent, always ensure the food is properly cooked and hot when served. Avoid raw food and vegetables. If you are having vegetables or fruits, just peel off the fruits and have it. Hand washing is must, and safe water. You can even purify the water when needed. And scrub typhus, this is transmitted through mite, and its larva's name is chigger. So because of it's usually it's placed over the vegetation sites or gardens. It's over the plants. These mites are present. So when you go there, they can bite. It's usually a painless bite. You will get if you see the picture, right side of the picture, you will see the one blackish part. This is a painless lesion. It can present over the axilla, under the surface of groins, or over the back or over the head. So you can't see easily, but only 60% of the patients will have this type of lesion. These people can also have a high grade fever, rash, and abdomen distension. Your liver and spleen can be enlarged and have a vomiting, diarrhea, and abdominal pain. So how you can prevent this? So avoid areas with lots of vegetations where chiggers may be found. Use long sleeve cloths and boots to reduce exposure. So avoid lying in the bare ground or use cover instead, and use repellents, or when you're going out, they have even mosquito and insect repellents are available. So you can use that, or use controlled insecticides by effectively eliminating the mites. And malaria. Malaria is also transmitted through a mosquito because of water collection. So what are all the symptoms? They have a high grade fever. In adults, they have usually presence with high grade fever, followed by chills and followed by excessive sweating. So, but these symptoms will not be present in children. They have simply have high grade fever alone. Along with they have a headache, they have a muscular pain, they have severe back pain, nausea, vomiting. Very occasionally they have a cough. So as previously told, how we can prevent the dengue by using a mosquito repellents and nets and insecticides. Similarly, malaria also have the same preventive steps. So for all these steps, you have to. So all the infections will have commonly have fever is a common symptom. So how we can differentiate or when to seek a medical medical advice when needed. So when most of the viral infections fever will last only for 2 to 3 days. At the most, they have fever only for 5 days. But like typhoid, malaria, and scrub typhus, they have mostly they have fever of more than 7 days. So viral infections less than 5 days fever. Any bacterial infection, fever may go for 7, 8 days, even for 2 weeks, they may go for 10 days. So when to seek medical attention? When you have a high grade fever that is more than 1 or 2 degree Fahrenheit for more than 2 days, and you have a persistent vomiting, that is 3 to 4 episodes of vomiting in a day, when you are not able to take any food and you have any decreased urine output, because these monsoon season they have normal urination around 4 to 5 times per day, but when you have a decreased urine output, when you are unable to take a food, so obviously the urine output will be decreased. So when you have a difficulty in breathing and when you have bleeding gums or black tarry stools, always consult a doctor immediately. So to prevent all this, there is a no solution. To have to for a droplet infection or from mosquito bites or from mite bites. On a lighter note, I have to finish with a simple solution by using a superstar stress. Thank you. Ma'am, mute.
So sorry. Thank you. Thank you, Dr. Karthikeyan, for that explainer. And we will now move on to our final speaker, Dr. K. Abhirami. She is a senior consultant and head of nephrology department at Kauvery Hospital, Salem. Dr. Abhirami obtained her DM in nephrology from All India Institute of Medical Sciences, Delhi. She's a member of the Royal College of Physicians, UK, and has also completed a fellowship in nephrology from University of Toronto, Canada. She's been with Kauvery Hospital since 2019, and prior to that worked in Sri Venkateshwara Institute of Medical Sciences, Tirupati, and SPMM Hospital, Salem. With more than 2 decades of experience, her professional interests extend to critical care, nephrology, epidemiology, preventive nephrology, and electrolyte disorders. She specializes in advanced procedures such as hemoperfusion and plasmapheresis. Dr. Abhirami's talk is on seasonal fever in healthy and unwell populations. Over to you, Dr. Abhirami.
Thank you, Ms. Basu. Good morning, everyone. Happy to be part of this webinar. So I'm going to talk about special population, meaning people who need more attention than the usual. Am I audible? Sorry.
Yes, ma'am.
Sorry, my slide's not moving. Give me a minute. So when we say special population, what we mean is people who are different from a healthy human being. So they might require more precautions or more treatment. Younger children, older age, pregnancy and all is just physiologically they are a little different. Their immunity is a little less than the others, so they will need more prevention. Apart from that, if you come to disease states, anyone with diabetes, anyone living in older people living in nursing homes where there are multiple people, anyone with any chronic disease of the internal organs, be it lung, heart, kidney, liver, blood, patients with cancer, patients suffering from HIV, which is an immunosuppressive disorder, meaning the immunity of the body is less. Then there are a lot of other patients who take medications to reduce their immunity. These are patients with arthritis, skin problems, some connective tissue diseases. So they are also at a higher risk for infections. Finally comes the transplant patients who are immunosuppressed medically so that they don't reject the transplants. So these patients have their immunity altered either physiologically or by medications or by their disease status. So they are not able to mount a good immune response. So they behave a little differently from the normal person when they get infected. So these kind of people require special attention during this monsoon, not only during this period, like they are supposed to follow these preventive strategies always. We tell our transplant patients to do all this always. So what are the things you should do? You should avoid overcrowding. Overcrowding is not just meetings. It could be a shopping area during festivals. It could be a wedding in the family. So any overcrowding should be avoided. If you are not able to avoid overcrowding, you have to be there. Then masking is must. We should learn from Japanese who wear mask all the time. Then food hygiene. So water and food. So water should be boiled. After that, it can be cooled and had, or if you're using RO at home, you are making RO water at home, then the cleaning of the RO tank, the change of the filters, those things have to be taken care of at the right time. Food should be freshly made. Food in the fridge and then heated in the microwave does not kill all the bacteria and contaminants. So it should be freshly made or it should be boiled every time to kill the bugs in it. Hand washing cannot be emphasized enough. Even the infections which spread in the air can be spread through hand nose touch. So the infection is spread through the air and then it is present on all the surfaces. We touch one of the surfaces, like let's say we touch the door, we open the door, and then touch our face with the same hand, we can get the infection. So all infections are spread by hand. So hand wash should be maintained. So best
Dr. Abhinami, can I interrupt? Though I can hear you clearly, but somebody from the audience has sent a message saying that you are not completely audible, and if you could maybe speak a little louder.
Yeah. Is it better now?
Yeah, yes.
Okay. So, and then finally, when we are using air conditioners at home, they have to be serviced and filter changes should be done at the right time. And the final thing is about self-isolation. We all know about isolation for someone who's sick, and then we tell them to isolate themselves so they don't spread the infection. But what we tell the patients with special needs are to isolate themselves during any epidemic season. Like now that there is rains and the flu season is going on, I would tell all my transplant patients to isolate themselves in a separate room from the rest of the family, especially if the rest of the family is going out. So all that you need is a room with a bathroom and a good ventilation, and you stay inside the room and you can do whatever you want. But when you're coming out of the room itself, you should wear a mask and be careful even with the rest of your family members. We call this self-isolation or reverse isolation. Then the most important thing is to vaccinate. Preventing infection is always better. Any disease prevention is better. So what are the vaccinations we recommend to people with special needs? So annual flu vaccination, this is something Dr. Karthikeyan also alluded to. So this vaccination should be given to all people with special needs, children and older adults. And this is usually it comes out every year with new viral strains. So the new batch usually comes to India around August. So August to September, we should get the vaccination done. But the monsoon in Tamil Nadu and all starts, at least in my parts of Tamil Nadu, starts even in July, August. But so we still wait for the August new batch to come. The previous year's vaccination will tide over to that period. So that is done every year. The next is vaccines against pneumonia. This is given to people with all people with chronic illness and immunosuppressed. So there are two vaccines to be taken. One is pneumococcal 13 strains vaccine, and then after 8 weeks, you give the 23 strains vaccine. There's a difference between the two. One is a conjugate vaccine, and then the other is a polysaccharide. But anyway, it is enough to know the two vaccines have to be taken. Hepatitis A vaccine is now available and it's usually 2 doses. And hepatitis A vaccine is a must for patients with liver disease who are undergoing liver transplant. Apart from that, it is used in children. Typhoid vaccine, now there are new good effective vaccines. Conjugated vaccines are available. It is a single dose and it gives protection for 3 to 5 years. Next. And coming to the treatment part of it, the treatment of the infections is the same as in general population. But unlike what Dr. Karthikeyan said, we normally recommend these patients to seek early medical care. For example, if patients are having a transplant, we normally they have an helpline where they can reach out. So even on the first day of fever, they would reach out. They might visit the hospital after 2 to 3 days, but we normally recommend all these patients to seek medical care, at least a helpline call on day one, because their illness is likely to be more severe than in the general population and they progress very fast. So they don't give enough time for treatment. So the attention should be early. I would stop here. Thank you.
Thank you, Dr. Abhirami, and I would like our audience to start sending in their questions, either to the respective doctors you have heard or whatever general questions you have. Meanwhile, what we understand is, of course, as all of you presented your talks, the set of symptoms during monsoon seasons are common, but the approach to treatment across all age categories, we are not talking about just the special categories, but across all ages, children to adult, that also is similar. So now, before the rain set in, before the flood waters get into our house, and knowing uh, the living conditions in majority of families in our country, what is it that would you suggest? Each of you, I'm asking to people in general, because we are these days all the time misguided by a lot of WhatsApp forwards to try this, to try that, have turmeric milk, have cinnamon water, have this, that. So basically, what would be that very general, layman's term before all this comes? I mean, all this hits us.
Shall I start it off?
Yeah, yeah. Each of you could give your inputs.
So, first, everybody has to aside there is no magic cure. So, no legium or kashayam or turmeric milk is going to save you completely from everything. If you like turmeric milk, please take it. But don't expect it to wipe out or eradicate all the infections. Infections will come, it will be there forever. You will have to live with it. So, before the infection comes, we probably will have to plan few things. First, who are the at risk group in our family? You might be having people who are above 70, 65, 70, might be having very small children, children who are less than 2 years, and people who have got comorbid illnesses, uncontrolled diabetes, recent heart surgery, transplant. This group of patients have to be vaccinated. And if you have a family with this group, it is also better for you to get vaccinated along with them. The commonest vaccine which we want you to take every year is going to be flu vaccine, because this is going to prevent you from getting flu in a very bad form. Still, you can get a mild flu infection, but it doesn't make you sick or get you admitted in the hospital. It's basically the thing. Second, whenever somebody who goes out comes back home, like the children coming from the school or young adults going out, they are the ones who go out a lot and they catch infections easily. Make sure they don't immediately mingle with the high risk group. Like, for example, as soon as a child comes home, let the child wash hands, have something to eat. For an hour or two, if the child is fine, the child can go and mingle with the grandparents. Let not the high risk grandparent greet the child and hug them immediately from school. If this becomes a habit seasonally, the chance of an elderly person getting admitted will go down. Third, if you have a problem, if it's going to be a mild fever, hold on for 2 3 days. If it's going to be a high risk, visit the doctor immediately. Don't go for over the counter treatments. Don't go to the pharmacy, get something and pop the pill immediately. Let's say you had fever for low grade fever for 2 3 days. If it's been typhoid, as I told you, most of the fevers are very similar. We do have some ways of differentiating. That's how I tell you it's this and that when you come initially, but that's after several years of 10 or 20 years of experience. So it cannot happen immediately. So at that point of time, you come back with 2 3 days of antibiotics, diagnostic chance goes down. And nobody requires antibiotics in the first 48 hours. So don't do that. Paracetamol should do. And fourth important thing is good hydration. What people forget is when people have fever, what is most important? It is not your paracetamol or antibiotic. The most important is hydration. You need to take adequate fluids. It might avoid an admission as such.
And I also believe in good rest and sleep.
Yes,
That really helps.
definitely.
Often most of us don't get it. That is the
Yeah.
problem.
Yeah. Would you like
Right.
to add your inputs, Dr. Karthik and Dr. Abhirami?
As a pulmonologist, I want to tell even pranayama helps in asthmatic patients, and even for yoga is good for health. So it has some benefits in airway, help in asthmatic patients.
And my point is
So
much more general than that. I would say healthy lifestyle will keep you healthy. So immunity also would be better. So avoiding weight gains, being too obese, all that. So you talked about before the rainy season. I'm talking about overall,
Oh,
even a
all
bigger
these.
picture than that.
Yeah. So Dr. Karthikeyan, you mentioned in your talk about, like even you did, Dr. Vijaya, that when you get fever, you wait for 2 days and then you see whether the fever is subsiding. So is a blood test also necessary? Like when, suppose the fever doesn't go off, so what should the person do? When would you recommend a blood test actually?
most of the time, most of the viral fever will have a high grade fever for 2 days. After 2 days, mostly the fever will become low grade. That will be present for 2 or 3 days. So totally, most of the viral fever will spontaneously resolve within 5 days. So that's why
So
if the
there's no
patient
need for a test then.
no, not needed.
Uh,
So just give
oh,
paracetamol. Just give paracetamol alone is more than enough. So after even after 3 days, if the patient is having high grade fever or if he is unable to take anything, it's better to visit the doctor.
so I'll add on something here. So we do something called as risk stratification. For example, if a healthy child comes, probably this is what Karthi is going to do. Perfect. If a 24-year-old healthy adult comes, for me, if the hydration is good, I probably wait for a few days. If it's a 65-year-old, 70-year-old individual coming in, I probably will test earlier. I probably will start on medicine earlier. If it's a transplant patient, probably Abhi will start things earlier. So this depends upon something called risk stratification. That's why we say after 2 days, if you don't settle with paracetamol and good hydration, and as you said, good rest and sleep, visit the doctor because the doctor will risk stratify you. And if you come under a low risk category, we just follow you up. If you come under a high risk category, then probably will test you and probably treat you. Sometimes you may even require admission, sometimes we send you home, but that happens only after seeing you and stratifying you. That cannot be just like that. There is no uniform pathway for everybody, it varies.
Right. Dr. Abhirami, you focused on vaccinations. So could you please give that timeline, like from when should this vaccination, whether it's flu, whether it's pneumonia, it should start? Because as you also mentioned that it's annual and new batches keep coming each year and you gave the time period. So what happens if somebody misses it 1 year? Does it kind of affect in any way? Just that little bit detail on vaccination.
Flu vaccination, if you miss a year, probably okay. But you are having an entire year. If you missed it in August, September, you can still get it in October, November. So it is difficult to miss something for an entire year. So that is, I think you find it irrelevant. So it should be done. Right now, the pneumococcal vaccine, typhoid vaccines, and all are given for children. So I think pneumococcal vaccination, most of the pediatricians do it. Okay, when it comes to adult population born before 2000 or 2005, that is the time when these vaccinations were not part of the schedule. So in that kind of population, we vaccinate people at high risk. So older age group and all those at risk population I talked about would get pneumococcal vaccination, flu vaccination, and definitely herpes vaccination, varicella. Sorry. Okay. Hepatitis A and typhoid is a little depends on the doctor. Liver patients would definitely get hepatitis A vaccine. And again, in children, nowadays, I think it is routine. Dr. Karthikeyan can correct me if I'm wrong. Typhoid vaccination also nowadays is routine in children. In adults, it's difficult to get typhoid unless you are eating out and drinking unsafe water and things like
Most of
that.
us are.
In that case, at-risk population should get that. But pneumococcal vaccination and flu vaccination is a must for all high-risk population.
Right. No, it is for the high risk or people who already have some kind of ailment. And it's not about actually really missing. People get complacent and a healthy individual would rather get complacent and, a little irresponsible is not the right word, but they don't go for. There are many people I know still who don't take these vaccines. So that's why I asked that question, whether, and if somebody's off vaccines.
The
Doesn't
pneumococcal
matter.
vaccines are all only just once. And because they have chronic illness, they must be seeing some physician regularly. I think if there's a commitment from the physician side, also it is possible to get the vaccination done.
Renu is asking you to emphasize on hand washing because, and also with soap, without soap, scrubbing for 20 seconds, which reduces the virus. If one of you could get tell the audience properly how many times, that like it doesn't matter how many times you wash your hands. It's good to wash as many times, perhaps.
Yes, COVID epidemic has kind of taught us that hand washing helps. This was despite it being droplet. But one good thing it brought in is it brought in a habit of hand sanitation and hand washing. Despite so much of advances, every day I still see typhoid fever in adults. I handle adult people. So water sanitation is really bad. So one good thing about our country is wash your hands before and after food. We should also wash hands after toilet, after going to your washroom. Make sure you wash it with soap and water. So generally, if you apply soap properly and cover all the areas, it will at least take 20 seconds. So if you're not able to have a soap, wash it thoroughly with fresh water. It's a minimum you can do. So I don't expect the general public to follow all the steps. Make sure you take like at least one push of soap in your hand or completely cover both the hands. Then wash all the aspects, both inside and outside completely. That will definitely help to decrease the incidence of infections. To be frank, if you take up apart the commonest reason why human beings survived, I'm talking about how we evolved from 35, 45 years of mortality to 70 years was because of increased improvements in sanitation. As the sanitation improved, a lot of times, a lot of things went away. Despite all these things, all the developing countries are still not able to give good sanitation. So, hand washing is going to handle half the problem. So make sure you hand wash, but it should not become obsessive also remember, if it is not a contaminated hand, if you don't have access to water, hand sanitizers are fine and it disappears early, you can use it, and maybe within half a minute or 1 minute you can even think about having your food without major problems.
Right. Dr. Karthikeyan, since you specialize in respiratory disorders. So when winter sets in or when the weather is little, there's a nip in the air, people immediately start, a lot of people do start taking steam. And when at the slightest of little breathing difficulty, people also have seen self-medicate by nebulizing. And of course, gargling, hot water, all gargling is all that is also happens. So how, when would you advise these things to be done, whether you are ill, you're not ill? Could you explain
Usually,
that?
I usually avoid steam inhalation and nebulizer in home because if you use steam inhalation, the totally cilia will be restricted. As ma'am told, it's a protective mechanism. Actually, cough itself is a protective mechanism. It brings out the foreign bodies in the nose and so it's better to avoid steam inhalation. It's even destroys the cilia and the nose. So it will further aggravate the infection only, not giving any relief. If you want to clear the nose, you can use the saline wash or even saline nasal drops are easily available. So that will be useful. But steam inhalation, it's not advisable, and nebulizer is definitely not advisable in home. Because it has side effects, it should be always nebulized along with oxygen, not nebulizer alone in home. So it's a inhaler is the best with no side effects. So always prefer inhaler in asthmatic patients. Never use nebulizers in home. And native medications, honey is the best because honey it's recommended after 1 year of age. Just 1 teaspoon honey morning and night is more than enough because it doesn't have any medicinal property. Just it forms a coat in the throat, so it decreases. There are more cough receptors in the throat, which decreases the sensitivity of cough receptors. So honey is the best medicine to decrease the cough. That's all. Any other thing is no additional role.
Now, you spoke about honey, and Manohar ji is saying that kids' flu is very common now and is lingering for long as well. So he's asking for some medicine recommendations.
Most of the time, viral cough will last even for 21 days. So almost 3 weeks. And less than 5 years, their immunity is on developing stage. So they will get repeatedly cough every month. So almost 21 days per month, and almost in the 365 days, almost it comes around 8 to 9 months of cough in children. So it's normal for children. So whether your child is adequately normal or not, if he is coughing, just check the weight. If his weight is progressively increasing, its appetite is good, you no need to worry. So, and you have to look for the intensity of cough. Most of the viral cough will spontaneously resolve within, and the intensity will reduce after 7 days. So their intensity increases around 3 to 7 days, and their intensity of cough reduces after 7 days. So if the cough persistent, if they have cough, if it is persisting for 21 days with increasing intensity or same intensity, you need to worry. Otherwise, you don't need to worry.
The same person is also worried about what stage should a child be admitted. Is it advisable if the patient also has fever?
Simple. As பா- குழந்தை பாப்பா பால் குடிக்குது குடிக்கல. If the child is able to drink water or able to drink fluids and the urine output is good, you don't need to worry. If it is a healthy child, I'm telling about healthy child, not immunocompromised child. As ma'am told, if it is a immunocompromised child, you have to admit on day one of fever itself. If it is a healthy child, the child is actively playing. That is a term called interfebrile period. That is, if you give a paracetamol, the fever will subside, and the fever after fever subsided, the child will be completely playful and active. So even in fever, some children are roaming around. So the child is actively playing while having fever, or in the interfebrile period the child is active, you don't need to worry, just observe.
Dr. Abhiram, could you now a little bit speak about the dietary restrictions to be observed during rainy season? Are there any, or what? I mean, I know people will tend to avoid curd or having, so if those kind of things, if you would like to focus on, all of you could give your inputs.
You don't get infections from food. So the ones who cough after taking some food are the ones who have asthma tendency or allergy. They might sometimes get a asthmatic attack with cold food and other things. Okay. Otherwise, you don't get. I mean, this is a very common misconception. You take sore things or cold things, you will get a flu. I don't think it comes from that. The restrictions in food during monsoon is for the hygiene part of it. So uncooked food and raw water, not boiled water, I would not take outside. For example, if I have to eat outside today, I would not take the salad. I won't mind eating the heated food. Okay, so that is because of the water contamination and the diarrheal illness, typhoid, and other things they talked about. You don't get virus from food.
Dr. Vijay Lakshmi wanted to add something.
Yes, simply that the usual thought process is curd is a cold food and it should not be taken with fever is absolutely wrong. Curd, it is rich in probiotics. It has got good protein, easily digestible, much better easily digested compared to milk. So if you have fever, please take curd. If you have fever, your B complex vitamins come from your citrus vegetables, citrus fruits. Take juices, coconut water. So when you have fever, your fluid requirement increases by 50 to 100% more than what you need. For example, if you're taking 1.5 2 liters, your requirement may be 3 liters plus. If you're avoiding all these things, what will you have? And similarly, the general thought process, when I have fever, I have to drink warm or hot water. That's also wrong. Because when the water is very hot or very cold, the amount you can consume goes down dramatically. You'll never be able to hydrate yourself. If you feel comfortable with warm water, please, then still it should not be very hot. Because if it's very hot or very cold, it can stimulate cough. It can irritate you further. So lukewarm water or normal water, juices, soups, kanji, curd, curd or buttermilk, coconut water, all these things are very, very helpful. Diabetics, please avoid juices. And if you have a diarrhea, we tell them to avoid juices because it's all hyperosmolar. Diarrhea becomes for a long time. You have to go for ORS. Otherwise, all these liquids are extremely good during fever period.
Like you mentioned, that food really doesn't affect, the condition. Likewise, people also have this thing about getting wet in the rain. And they feel if we get wet in the rain, we immediately fall ill. So you could also elaborate on that and clear the myth.
Yeah. Okay, I'll start it off. They can continue with that. See, when you become cold, when you get wet in the wind, you have an internal homeostasis. The body tries to maintain. We are all warm-blooded. It tries to maintain your temperature. So when you get wet and come out, or if it's really chilly, your nose, ear things becomes very cold. You can have some congestion in the nose area. So that way you feel as if you have cold. You can have sneezing smells. If you're an allergic person or an asthmatic person, you can have an asthma attack. But that is not an infection. But what can happen after that is, like for example, you're traveling somewhere to attend a wedding. You get completely drenched, and the wedding is overcrowded, and your nose is congested. If your neighbor has a viral infection, you can easily catch it. Your chance of catching a viral infection when your nose is congested after rains becomes higher. But going out in the rain or when you become cold cannot reduce an infection. This is a different, the whole thing, pathophysiology is different than. But you can have nasal congestion, you can have you can have cough, you can have sneezing. That's all your body's response. Karthi, you want to add something to this?
Yes, ma'am. Thank you. Actually, and most of the parents will come and say, ஃப்ரிட்ஜ்ல இருந்து எடுத்து குடிச்சிட்டான் உடனே சளி பிடிச்சிருச்சு இல்லைன்னா ஒரு ஐஸ்கிரீம் சாப்பிட்டான் சளி பிடிச்சிருச்சு ஸோ தே வில் ட்ரை டு பிளேம் இட் ஆன் ரெஃப்ரிஜரேட்டர் சாக்லேட்ஸ் ஃபுட்ஸ் மோஸ்ட் ஆஃப் த டைம் பட் மோஸ்ட் ஆஃப் த டைம் அவங்க டெய்லி ஸ்கூல் போயிட்டு வருவாங்க ஸோ ஸ்கூல் இஸ் த சோர்ஸ் ஆஃப் இன்ஃபெக்ஷன் ஸோ இஃப் ஒன் சில்ட்ரன் கெட்ஸ் கோல்ட் definitely the whole class is going to get cough and cold. So it's because of the droplet infection, not because of refrigerator or something. But if they get ice creams or something from refrigerator, if they not wash properly for so long, so that becomes a source of viral infections, and they get cold because of the virus from refrigerators. So proper cleaning is essential for maintaining the refrigerators.
Dr. Abhirami, do you want to
And
add something?
as I already told, food is not a restriction. There are histamine containing foods are there because citrus fruits containing histamines. So only if the person is allergic to that food, you can avoid. It's just a food challenge alone. So you can take all fruits and you can take all, even tender coconut also, but tender coconut containing histamine. So only in asthmatic patients, some, not for all, some patients, some children will get these because of having these histamine containing foods, but they never get cold because of having these foods.
So likewise, when the rains come and we also see water stagnation, accumulation, and people wading through the waters to reach their homes or walk to their offices. So in that case, one straight goes into the office. So could you also elaborate on what one needs to do after you've waded through, say, the monsoon waters on the streets?
Shall I take it? First,
Yes.
wash your foot with soap and water and dry it. Because if it's going to be wet for some time, what happens? The interdigital space that is between your toes, your water can stagnate for a longer period of time. If there is maceration or some other problem, or you're a diabetic, the chance of getting fungal infection increases. It's called intertrigo. You will see a lot of older people, when you just take the swabs between the toes, you'll find some whitish area. That's the skin being macerated, secondary fungal infection. And then this often leads to something called a cellulitis, that is the leg swelling up and getting infected. So make sure when you wade through water, you come back, wash with soap and water, dry it up. If you're not able to clean up, you can just apply ordinary powder. A lot of times elderly people say that I don't have anybody, I won't be able to clean properly. No problem, clean as much as you can, apply powder. Powder absorbs some moisture. So this has to happen twice a day, especially if you're going to go out with your leather footwear also. Second, if your footwear is leather or something, please change it to normal plastic ones. Because leather absorbs moisture, it becomes soggy,
Yes.
and even fiber becomes soggy, and that increases the chance of fungal infection. Third, if you have injury, there are chances of you getting certain infections like leptospirosis, melioidosis. If it's been acute flood, you waded through it, you have an injury, we generally give a prophylaxis. You will have to visit a doctor to see whether you require it or not. Beyond that, make sure the water is taken off in the seats. That's more than enough.
Yeah. So there are a couple of very specific questions regarding to medicines. I'll quickly ask you. Somebody is asking, do steroids have a role to play in monsoon illnesses?
No.
No. Patients on steroids are at higher risk for infections. No steroids, please.
Mm.
You know what
Um,
happens? Fever comes down, people pop it up, and it becomes a habit. Please don't do that. That increase the risk of problem. So from me, they will go to Abhi. They become immunocompromised. Got it?
mm. Then what is dexamethasone tablet, which is given
Safe.
very commonly in medicals for any sort of infection? Is
That
it
is
safe?
why you shouldn't go to a pharmacy for treatment. It is a steroid. No, no, please don't take.
Mm.
Simple. Actually, fever is also a protective mechanism. When you get an infection, our immunity will become activated and will produce some kind of mediators, chemical mediators that will cause fever. So that itself destroys the our microorganisms in our body and get help in recovery. So if you give steroids, it will totally suppress these chemical mediators. So immediately the fever will suppress, but the infection will be still there in our body. So it will become worse later. So it's always avoid steroids in normal infection. So fever, it's a protective mechanism. So our body is actively working. So you have to be happy that your body is
It
happy.
got you.
Yeah.
Adding on
Uh,
to what Karthi said, always don't get obsessed with the fever coming back to 98.6 or 99 or 100. Because unless you're very young and if you have very high fevers, let's say child less than 2 years with 103, 104, fever doesn't kill you. Fever just tells that there is something abnormal. You will have to visit your doctor. You will have to increase your fluid intake. Fever tells you that you need more fluid for your body. So take a paracetamol. If it doesn't get suppressed, doesn't matter. Don't pop up a painkiller. Like what happens when the fever doesn't come down? Next is NSAIDs, Meftal, or they
mm.
go for ibuprofen, or they go for steroids. No, fever doesn't kill you, but these medicines can if they are taken without any lime and logic. So if a doctor decides to give it, it would be after a lot of evaluation. So fever will not just like that kill you. So if it's going to be a young child with a very high fever, the child has to be admitted. Don't decide on your own. If you have fever 100, 101, tepid sponging paracetamol should be enough. Fever will automatically settle down, or we'll find out the cause.
Mm.
Just one
So,
thing about steroids, because I made it out to be the biggest villain. If it is prescribed, and then if it is, there are certain infections where we do prescribe steroids during the recovery phase. That should not be confused with taking steroids for fever from the pharmacy. Steroids, just as a primary treatment, is definitely no no. It actually reduces the immunity, it masks your symptoms, you will have a false sense of well being. But steroids are sometimes used in the therapeutic armamentarium that is prescribed by the doctor. So just because it says steroids are no no,
yeah,
don't
get
go
your
and
point.
fight with your doctor about
Right, right.
prescription.
Yeah. Somebody's asking if one is typhoid positive, when the typhoid vaccine has to be taken and is a single dose enough.
Yeah,
Um,
single dose is enough. Yes, ma'am. You can
Yeah,
take.
please go ahead.
A single dose is enough. If the I'm talking about children, so if the child has typhoid, you can take after 28 days of infection, of recovering from infection.
So generally, it stays active for at least 5 years. If you're somebody who's been traveling out a lot, for example, you're going to be a salesperson or somebody who eats out all the time, so we give it every 5 years. But generally, one dose in adults when they come to us is fine. And remember, this typhoid positive is always something we
Yeah.
take with a pinch of salt because everybody has one viral test and it will be positive forever. So they run around saying that they have typhoid lifelong. It doesn't happen. If we do our viral test, most of us will be positive. So typhoid has to be clearly confirmed by a doctor for you to take the tag along, and which will be by blood cultures.
So Jesse has a question on jaundice. Does a hepatosplenomegaly patient, female of 26 years, who's got jaundice 3 times so far, should she be vaccinated now?
First, she should be evaluated why she has hepatosplenomegaly. And if it's going to be hepatosplenomegaly with jaundice, she must be having some problem which we need to figure out. And we have to, the vaccination has to be timed. So, for example, if somebody has an infection, we don't give vaccine at that point of time. We time it after the recovery. And a certain immunocompromising status, it may not be just these 2 or 3 vaccines. You will have few other vaccines to be given. First, a problem has to be addressed. We need to identify the problem statement, put in a solution, and then decide about vaccination, and also the timing of vaccination.
Right. So I think we've completed, come near to our close, come near to our closing time. So one more time, if you all of you could very clearly reiterate, because rains means everybody's thinking about cold, sneezing, coughing, fever. And all the other waterborne diseases can happen any time of the year because of contamination of food and water. So quickly, like if one is having fever, like how much fever, how many days, and how many days of persistent coughing, or one need not overthink and go for medicines, as we say, across the counter or rush to a hospital. So those kind of little bit of clarification, if one all of you could just reiterate, which where we directly just think monsoon means these are the things which are likely to happen, whether you're a kid or an adult or a special risk group.
So I'll start it off and start the ball rolling. So if monsoon is coming, always see who are high risk in your family. Make sure they get vaccinated. If you can afford to get yourself vaccinated along with them, that will help a lot. Make sure you have water hygiene. That means no to your canned water. Make sure water is boiled, roll boil for 3 minutes, and then you store it. Don't store it for more than 24 hours and drink from it. Similarly, if it's going to be milk, 3 minutes roll boiling. Your fruits and vegetables, clean it, peel it, and then eat it. And if somebody has cough and cold, put them in a separate room. Make sure till the fever goes down, at least for 24 hours, till the fever goes down, they don't mingle with the people who have got low immunity. Please don't send your children to school when they have fever. That will prevent other children from getting infected.
Yeah. Dr. Karthikeyan, would you like to add?
So cough and cold mostly settle within 7 to 10 days, so don't need to worry. So as famous saying, superstar still the மருந்து கொடுத்தா 7 நாள் சரியாயிரும், கொடுக்கலனா 1 weekல சரியாயிரும். So anyway, it's going to settle within a week or 10 days. So don't give much importance to cough. Only if the cough disturbs the sleep, get consult a doctor. So, or else you don't need it. That is early morning cough. If the child is having coughing that disturbs the sleep or its activity is limited because of cough, consult a doctor. And the most of the time, fever will spare a high grade fever. When you say high grade fever, it's more than 1 or 2 degree Fahrenheit. Have thermometer in your hand. So check your temperature in your axilla. So if the temperature is more than 1 or 2 degrees, it's called high grade fever. It will mostly the viral infection have high grade fever for 2 days. After the third day, the fever will become low grade, that is less than 1 or 2, and it will settle within a day or two. So most of the time, 4 days, the fever will settle. So make sure the child is active, make sure the child is hydrated, make sure the child is actively roaming. You don't need to worry.
Yeah, Dr. Abhiram, finally you can wrap up the alarm bells when we need to hear them.
Yeah, my point is I just wanted to reiterate hand hygiene because in the summary it has to come. So hand hygiene is a must for everyone, not at risk or low risk, and uh, no self medication. Okay, don't worry about fever, but patients who are at risk, they would know. Normally, the doctor would have told them because of this. If you have fever, please report immediately. At least I would tell my patients. So the ones who've been told they are at high risk for infections should get an early attention. And healthy person can wait out, and they would their immune system would take care of the virus most of the times.
Right. I think we really need to reiterate messages from our medical experts, given how the social media kind of keeps flooding us with all kinds of information. So we all basically need to stay proactive without the getting into the hassle of health issues, and best is to perhaps keep ourselves warm and dry and never to undermine our own health during the monsoon season. I once again thank all our panelists for sparing their time and the audience for tuning in and sending in their relevant questions. So today's webinar on monsoon illnesses management and cure was brought to you by the Kauvery Hospital under the Hindu Wellness Series. Thank you all.
Thank you.
Thank you.